Right, we are live.
We are live. Great. Then and here's Cassandra. I will call the meeting to order. And I want to begin by welcoming Brent. Brent Benson is a new member. He is the state auditor's appointee. So welcome, Brent. You're going to find this, as we said earlier, a shorter meeting than usual. So we will be brief and succinct in this meeting. So we'll begin by approval of the minutes. First, are there any corrections, changes, additions? I'm looking, raise your hand, look up, look interested. No, okay. Because we're on Zoom, we have to do a roll call. So I am going to read out your name of, read out the names of the people who were at the meeting so that they can vote. Laura Adams.
Yes, yay.
Okay, Ray.
Yes.
Bill Geary.
Yes.
Lauren Peters.
Yes.
Yep, Niels. I think I saw Niels.
Yes.
Great. Cassandra.
Yes.
Meredith.
Yes.
Great. And Sandra.
Yes.
Great. The minutes are approved. And before I turn it over to Ray, I want everyone to notice and want to recognize that this will be his last council meeting as the executive director. I'm going to let you introduce the succession plan, Ray, but I wanted to say a minute or two about you, if you don't mind. I want to recognize the work that you've done over the years. I think all of us want to thank you immensely for leading through a pandemic, lots and lots and lots of reports, APCD changes, people changes. A lot has happened over the last few years, and you've been an outstanding leader, and I want to thank you for that.
Thank you so much. I really appreciate that. That
Well
means
done,
so
Ray.
much.
Congratulations.
Thank you.
And I will turn it over to you to make your remarks.
Well, thank you so much, Faye. Well, actually, I'm very excited to say it's not really an agenda item, but this leads naturally into transition talk. And so I'm super excited to say, for those of you that don't know, I think all of you do, but the three appointing authorities, the governor, the attorney general, and the state auditor, have chosen a successor, and it is Lauren Peters. And we are very excited for her to be joining CHIA. And yeah, I've been working with Lauren my entire time at CHIA, and she's outstanding, and she gets CHIA, and I think she's going to be just a remarkable leader. So we're super excited. But at the moment, Lauren is actually still here as a representative of EOHHS, but I'll let you speak for a second, Lauren.
Sure. Thank you, Ray. First, I just want to say thank you and express my gratitude to the appointing authorities, Governor Baker, Attorney General Healy, and Auditor Bump. But really just want to say how incredibly excited I am to join the team in early January. Ray has left some really big shoes to fill, but with the A-class team that he helped build and with guidance from the council, I'm not only confident, but committed to making this as smooth a transition as possible. So with that, I will work to set up time with each of the council members once I've officially landed. Again, my first day is in January 3rd. Last day here at EHS will be the 22nd of December. So approaching quickly, but still lots of work to get done. And want to just say that how much I'm looking forward to working with all of you and the entire CHIA team in the new year and in this new capacity.
This is fabulous, fabulous. Congratulations.
Yeah,
Thank you.
congratulations. And
Excellent, Lauren.
yeah,
Very exciting.
yeah, way to go.
Yeah, it just seems anticlimactic after this. We do, in fact, actually have a very short meeting for today in light of kind of the transition, the nature that we're in. And actually, there's transitions happening in the larger state government world around us. This is CHIA statute requires quarterly meetings of the Oversight Council. And so we are convening and having a quick meeting, but rather than go through the typical presentations on publications or major work product, this will be a more streamlined session, and then you'll convene again in March with Lauren, and it'll be regular meetings, going forward. So in terms of the agenda items, I'm trying to think. Well, there's a couple of items in the executive director's report, and then I'm going to turn it over to Emma Schlitzer for an update on publications and legislation. In terms of executive director's report, really, it's the transition is the big news, and you've just heard about that, and we're very excited. I have to say, I think the staff is very pleased at the selection and is going to work really well with Lauren. So I expect everything to go very smoothly. In terms of the financial update, we're in the middle of fiscal 23 and we're working, as always, to make sure we come in with a balanced budget. We just had a mid-year update that I received this morning, and we're on track, actually a small surplus, which means we have a little bit of money that we want to make sure is deployed to do good things, but we're in a good position. We're working with the Executive Office for Administration and Finance on our fiscal 24 budget. It will be the new administration filing it, but kind of all the preparation work that goes into a budget that's underway. So we'll be waiting to see how that comes out. But other than that, there isn't any other news about CHIA's finances, but they've been, I guess I will just say, since this is my last meeting, it's been sort of a long, strange trip on some levels with CHIA's finances, but the cooperation from the Oversight Council, but from the legislature, the Executive Office for Administration and Finance, and the Executive Office for Health and Human Services has just made it really a pleasure to be able to navigate those issues. But I don't know if there's any questions on finances. I know I've just been very general, but yeah, I think I'll move on. So let me turn it over now to Emma for an update on legislative and publication matters.
All right, thanks, Ray. I am now going to provide a brief legislative update. So since our last council meeting, Governor Baker has signed 2 bills into law that reference CHIA in some capacity. The first, an act relative to step therapy and patient safety, limits the application of step therapy practices. The new law, which was signed on November 1st, requires insurance providers to approve or deny step therapy exemption requests within 3 business days or 24 hours in an emergency, among other reforms. Additionally, the new law creates a special commission under the Division of Insurance that CHIA will have a seat on. The commission is charged with assessing the implementation of the step therapy process reforms and studying the impact of step therapy protocols, including on total medical expenses, premium costs, and out-of-pocket costs, and the healthcare cost benchmark. Also in November, the governor signed an economic development bill. The legislation provides new investments in education, clean energy, affordable housing, and health and human services, including $350 million for Massachusetts hospitals. The eligibility criteria for hospitals reference CHIA data, specifically relative price and public payer mix, and the funds will be distributed by the Secretary of Health and Human Services. And then just lastly to note, as we approach the end of session, we are looking ahead to the next session beginning on January 4th, and I look forward to updating the council at our March meeting. All right, so if there aren't any questions, I'm now going to pivot to walk through publications that have been recently released, followed by an overview of what's coming up next. So since our last meeting, we have released the annual FY21 Hospital Financial Performance Report, in addition to a quarterly report with data through the end of June. In October, we also published a quarterly update of hospital inpatient discharge data with data also through June 2022. These quarterly updates use interim data to present analyses on a monthly basis to provide timely patterns and trends on key inpatient utilization measures. Also in October, we published the latest behavioral health and readmissions report with FY20 data. The report provided an updated analysis of the prevalence of readmission patterns for individuals with comorbid behavioral health conditions discharged from Massachusetts acute care hospitals. And then additionally, last week, we released a new research brief that examined the association between race, ethnicity, and potential reliance on the emergency department for healthcare.
Which I think people might have seen that received some good press coverage. Yeah, it's a neat, this is another example of where our research team, because we get 5,000 respondents for our statewide household survey, which is a lot, but you can only do so many cuts with 5,000 respondents. If you want to look at race, we collect race and ethnicity data, which is great, but you can't look at race and income because the cuts start to get too small. So the team has worked to do some really sophisticated methodology work to combine 3 years of household survey data to get a larger sample size to be able to drill in on certain things. And they've used that technique again here to be able to drill in on emergency department reliance, breaking it down by race and ethnicity and other categories. And it's a really interesting bit of work. And we were pleased that it received some good coverage.
Ray, just congrats to you and the team on that report. I thought it was pretty novel and really well done. And would love to see more, new reports kind of like that. But I thought it was really, really excellent.
Oh, thank you.
Great.
And I'm sure you will.
So Alex, if you want to go to the next slide, perfect. So lastly, in November, we did complete 2 mandated benefit reviews and released the latest edition of CHIA's newsletter, Data Matters. And now we can look ahead to what is coming up in the next few months. So we will have the next quarterly hospital financial performance report forthcoming, in addition to the hospital inpatient discharge data annual report that contains key measures of inpatient utilization overall and by hospital, patient, and discharge characteristics for federal fiscal years 2020 through 2021. We will also release the next adult all-payer hospital readmissions report that will present statewide readmissions by characteristics of patients and hospitalizations and readmission rates for individual hospitals and groups of hospitals. And then lastly, we are also working in collaboration with MHQP on a new dashboard to present metrics focused on primary care in Massachusetts. The 4 categories in the dashboard will be finance, performance, capacity, and equity.
And I will say that's a very exciting project to partner with an external organization that has a lot of credibility and expertise and connection to really good networks of provider organizations that bring lots of clinical expertise and thoughtfulness to bear. So working with them using largely CHIA data, but also data that MHQP sources from the work that they do. It's been a really positive experience, and I think the dashboard is going to be very popular and well received. And it kind of raises the question in my mind, and we started to have some discussions, should there be some other things like this, perhaps a parallel dashboard devoted to behavioral health. But we're very excited about the primary care dashboard coming online.
Who is it you are working with, CHIA?
It's called the Massachusetts Health Quality Partners, MHQP, they're usually referred to.
Okay.
Barbara Rabson's the executive director. They do really great work.
Yeah, and I think they're nationally known and respected as well as within Massachusetts.
Exactly. Yeah, they've been able, the vetting from national organizations on the work that's being done has been really, really cool.
Who are expected to be the primary consumers of the dashboard?
I think again, it's primarily, I think, the policy community, both kind of on Beacon Hill, but also among the the delivery system and the healthcare financial, so providers and payers. It's looking at a number of metrics of the system, essentially the health of the system. It's not all the data, because there's lots and lots of data points on primary care. This is an attempt using MHQP's expertise and that of their partners to cull the most important data points that point to how the system is doing, because it's under a lot of stress and there's a lot of issues with it. But I'm not sure if Emma or others on the call, perhaps that might be the best on the fly summary we can do, but we can get you more information about it. But it's really, I think, geared towards understanding the health of the primary care delivery system.
And I believe we are one of the first states to kind of approach it in this manner. I know there's some work being done at the national level, but we're excited to come out ahead of that as well.
Yeah, key metrics about capacity utilization and things like that.
All right, can you go to the next slide, Alex? And then I believe this is our last slide, but just lastly, we are working on 2 mandated benefit reviews, which are on track to be completed in February, and as well as release the next edition of CHIA's newsletter, Data Matters, which is targeted for January. And then also upcoming is the next APCD release with calendar year 2021 data. And that's all I have. If anyone has any questions.
And on the APCD, I'll mention we're sort of in parallel, continuing to do things the sort of what you could call the old way, while we're standing up the new enhanced APCD or EAPCD. So the old way was annual releases that are, and this is what the world has always worked with, and on some levels they continue to expect. And so we have to continue doing that. So these are annual releases of all the data. In this case, it's claims through June of 2022. So it's, this is not old at all, but it's for calendar year 2021 with 6 months of run out. So you wouldn't use the data, from the 2022 piece of it to, it's just the run out piece. But in any event, the 2021 version is now, or will shortly be available. It'll be provisioned to our users. The HPC David Seltz and his team are, major users of that. But simultaneously, we're standing up this new system that will be online, updated quarterly, and have many, many more enhancements built in. So our users will, each quarter, it's just an online platform. One day they log in, it's got the new data and the new enhancements. It'll be a much better way to deliver it, but people do rely on the existing data set and kind of the existing delivery methods and workflows. And so we're continuing to do that while we stand up the new online platform. So anyway, we're very excited. It's a major deal when we release an annual release. We're very excited to get it to our customers. I know David's team has a lot of plans for it. So it's a big deal that we'll be getting that out. All right. I think so. So that's really, that is the agenda. We did think about doing a presentation, but decided that just in light of kind of the transitional nature of things, I thought about making some concluding remarks, but I did that in September because I didn't know that I'd be here in December. So no reason to do it twice, I don't think. But it really has been just phenomenal, being the executive director of CHIA, a great team, great working with the Oversight Council. So excited about Lauren coming in. I mean, I think, if for some reason there had been a bad choice that would, whatever, kind of leave a bad taste in the mouth. But instead, I think it's just so exciting to think of what Lauren's going to be able to do with the CHIA team and with all the different stakeholders we work with. I think it's going to be great. So anyway, it's been wonderful. Thank you very much. I don't know if there's any other items or comments or David?
Can you hear me?
Yes.
Hi. Well, I often feel like I'm just the Raid cheerleading club on some of these Zoom calls, but I just once again just need to say how appreciative the Commonwealth is for your service, Ray, at CHIA. You have just done a phenomenal job, really, elevating an agency to be just the premier data agency across the entire country. Your legacy will live on in the EAPCD. I know that we'll get there. But you have your legacy also, I think, is really just building an incredible team, an incredible organization, empowering some of the talented staff that you have to really be at the forefront of how we use data to inform policy. And I think of some of the changes we made over the years in terms of just the healthcare cost growth benchmark and changing the timing, measuring primary care and behavioral health care and the spend. I know that is going to inform policy for years to come. So you leave, a really proud legacy at CHIA. I am currently sitting in an airport. I was just at a meeting with all of the many other states from across the country who are working on healthcare cost containment. And, our data assets are truly the envy of the country, and you're a big part of that. And from the Health Policy Commission standpoint, congratulations and thank you. And we are so excited to work with Undersecretary Peters to continue this legacy and to continue to be at the forefront of healthcare data, cost containment, and policy. And Undersecretary Peters is the clear #1 choice to help lead this agency in the future. So congratulations, thank you. My speech is over.
Thank you, David. That's very touching. That meant a lot. Thank you so much. You are a national legend, and so those comments, I'm glad this is being recorded. Anyway, well, so thank you again. Thanks, everybody. This has been great, but it's a small town. I'm not going anywhere. I'm not quite sure exactly what I'll be doing next, but I'll be around. I'll see all of you, and I look forward to that. So.
And we look forward to seeing what you're going to do in your next chapter, Ray.
Absolutely.
We know you're not gone.
I'll let everyone know.
Best of luck.
Yes,
Thank you so much.
to both of you, Lauren and
Congrats, everybody.
Thanks. Motion to adjourn. So
motion
moved.
to adjourn.
There we go.
Thank you. Take care.
Thanks, everybody.
Thank you all.
Bye-bye.